Well, good morning. My name is Dr. Samuel Agahiu. I'm a nephrologist, and today is Ask Your Nephrologist Question Day. So I guess we're going to have a series of questions, and I'm going to try to answer those questions for you. So I think we have a couple of pre-written questions already, which I'm going to try to answer. And after that is completed, we're going to kind of open the floors for any additional questions there's available. Okay?
What is kidney function and why are the kidneys so important?
Okay, so the first question is, what is kidney function and why are the kidneys so important? That's a really big and open question, but let me try to try to summarize it. So the kidneys does three really important things. Number one, it removes the waste from your body. Number two, it removes excess fluids from your body. And number three, helps balance the hormones. Well, it helps balance your blood pressure and it helps your body make blood. So the kidney actually does a number of really important things. So that's kind of the bigger idea of what the kidney does.
What causes kidney issues?
What causes kidney issues? That's a tough one. So when you think about the kidneys, you want to kind of think about kidneys in three parts. Something that comes before the kidney itself, and after the kidneys. If anything affects any of those parts, pre-kidney, the kidney, and after the kidneys, all those three things could cause kidney disease. So for example, if you lose blood acutely, that reduces the amount of blood that goes to the kidneys. That could lead to a kidney issue. If there's something intrinsically wrong with your kidneys, which could be a multiple of things, that could cause kidney disease. If there's something blocking the kidneys after the kidney makes urine, and as the urine leaves the body, that also could cause kidney disease. So there's three components that we look at, which is something before the kidney itself, and structures after the kidneys. By looking at all three components, we can try to figure out what exactly is wrong with your kidney.
What are the signs that something is wrong with your kidney?
So next question is, what are the signs that something is wrong with the kidneys? That's also a very big, broad question, and I guess the kind of things we want to look at. So we kind of know what the kidney does. The kidney helps you get rid of a lot of fluids. The kidney helps balance your system in terms of like pH. Kidney helps controls your blood pressure. It also helps your body make blood. So if anything is wrong with any of those areas, there's a possibility something is wrong. So number one, you're feeling your blood pressure is a little bit more elevated than it should be. That could be a problem. Sorry about that. Let me just turn this off. So number one, if your blood pressure is a little bit high, that could be a sign of kidney problems. If you're feeling you're a little bit more swollen, your ankles are swollen, your face is a little bit more puffy, that could be a sign of kidney problems. If you're using the bathroom more often, increased urinary frequency, that could be a sign of something is going on. If you notice that your urine is a little bit more foamy, that could be a sign of kidney issues. Or it could just be a blood test. You could check your blood. There could be something acutely wrong, and that also could be a sign of kidney problems.
I go to the bathroom often. Does that mean my kidneys are failing?
That's a good. So the next question is, I go to the bathroom often. Does that mean my kidneys are failing? That's also a tough one. So there's a number of reasons someone could go to the bathroom often. Number one, you could be on a water pill that makes you urinate more often. Number two, you could be a diabetic and not know it and cause you to urinate more often. Number three, you could have a urinary tract infection that causes you to use the bathroom more often. So the simple fact of going to the bathroom more often doesn't necessarily mean you have kidney issues. It just means you have something to look into. Now, in the process of looking into the reason you go to the bathroom more often, there may be something going on, something you have to look into a little bit more, try to figure out exactly what's happening.
Does cranberry juice help aid kidney function?
Cranberry juice. That's a tough one. So there have been some limited studies that looked, I'm sorry, let me go back and repeat the question. Does cranberry juice help kidney function? That's an interesting one. Cranberry juice is one of those things a lot of people have used in the past if they have a urinary tract infection. And the idea is by drinking cranberry juice, it helps remove the infection. There is some truth to that statement. So there's a component of cranberry, there's a part of it called fructose. Now this part of cranberry called fructose actually inhibit the ability of bacteria to stick to the cells of the urinary tract. So that idea being said, so maybe it works, but we've done studies that looked like if we gave people cranberry juice, does that reduce the infection? Unfortunately, this study hasn't proved to be proved to be successful. So 50% of people got better with cranberry juice, 50% of people did not get better with cranberry juice. So I can't really advocate using cranberry juice as a way to like prevent or treat urinary infection, but if you're using it and it's helpful to you, I think that's fine.
What is kidney disease and how can it be treated?
So the next question is, what is kidney disease and how can it be treated? That is such a broad question. So as we talked about before, there's three components of the kidneys: pre-kidneys, the kidney itself, and post-kidneys. So the most common cause of kidney disease are the two most common elements in the United States: diabetes and high blood pressure. Those two things could lead to kidney disease. Now, what kidney disease means is your kidney is not functioning the way it should. Now, the kidney does a lot of different things, as I alluded to earlier. It helps, keep your body in balance in terms of volume. It helps keep your electrolytes in balance. It keeps your blood chemistry balanced in terms of pH and acidity. It helps you control your blood pressure. It helps you make blood. So if you have kidney disease, any of these things could be a little bit off. And the job of a nephrologist, is actually try to figure out, how much kidney function do you have, what is wrong with your kidneys, and then try to help you with all those different components and help try to correct those things that are going wrong with your kidneys.
What are the common tests and procedures to check kidney health?
Okay, so the next question is, what are the common tests and procedures to check kidney health? So they're quite basic. So the normal thing you do is, so number one, we have blood tests, and the biggest thing we'll look at is something called BUN. The other one's called creatinine. That kind of gives us a general idea of what's going on with your kidney. Number two, we could do urine analysis to see if there's any protein in your urine, to see if there's any blood in your urine. So there's a number of different things we could do to check your kidney health. And the third most important thing that we can do is do something called a renal ultrasound. Having a picture of your kidneys gives a lot of information about what could be going on with your kidneys. And the other thing is, a lot of people have family histories of kidney disease. So if you have a family member with something like autosomal dominant polycystic kidney disease, and your mom had it, there's a good possibility that you may have it. So just doing a very thorough evaluation, just speaking with the patient, gives me a lot of information about the possibility of having kidney disease.
How do I know if I have kidney stones, and if I do, should I go to the hospital?
Okay. So the next question is, how do I know if I have kidney stones and should I go to the hospital? Well, kidney stones is one of those things that if you have it, it's pretty prominent. Well, if you need to do anything about it, it's actually pretty straightforward. Kidney stones are probably one of the most painful things anyone's ever going to experience. If you have kidney stones, you're going to start feeling like a throbbing pain in your lower back. And that throbbing pain in the lower back is actually going to start going down your groin. It's going to be very intense and it does not go away. It's excruciating. And if that continues to happen, please go to the emergency room. Basically, what we're going to do in the ER is give you IV fluid, give you some pain medication, and do imaging to see how big the stone is. If the stone is less than 6 millimeter, you're more likely able to pass the stone on your own. If it's greater than 6 millimeter, we'll probably have to go and get it. So that's how we kind of know what you need to, if you need to go to ER. When that pain comes and it's not relieving, go to the ER. Now, there are other types of kidney stones that you do get that you may not be able to pass, actually don't feel. And also, the other way you may know you have a kidney stone, if you have a urinary tract infection, and we treated this urinary tract infection, and it seems to keep on coming back over and over again, it's a possibility of a stone. So what we do again, we do imaging, either with an ultrasound to see your kidneys, there's a big stone there, or something called a stone hunt, which is a CT scan. And a CT scan will look to see if there's a stone there to be found.
How can I improve my kidney health? Are there any dietary modifications that I can make?
So the next question is, how can I improve my kidney health? And is there any dietary modification you can make? This is a tough question. So unless you have pretty advanced kidney disease, let me just go back a little bit. There are 5 stages of kidney disease. And each of the stages, so the more advanced your kidney stage is, the more likely I'm going to tell you there's certain things you cannot have. Because as the kidney functions, there's some things that your kidney does, like for example, it gets rid of potassium, it gets rid of phosphorus. And the problem is, as your kidney function declines, you're unable to get rid of these things. So with people with pretty advanced kidney disease, I'm going to tell you to eat food that are low in potassium, eat food that are low in phosphorus, maybe decrease your protein intake, because by eating those foods, you put more work on the kidneys. But overall, there's no specific diet to improve your kidney. at the very beginning. So the best thing I can really advocate for is to have a healthy diet, a balanced diet, low salt, and just being able to exercise. So I think the more healthy you are overall, the better you do in terms of your kidneys. I mean, I normally just don't look at the kidneys as one thing. You kind of look at the whole person, the whole person. And if you are healthy overall, more likely your kidneys are also going to be healthy overall.
Is it possible to have kidney disease and feel fine?
So the next question is it possible to have kidney disease and feel fine? The answer is yes. So one of the most common causes of kidney disease is high blood pressure. So someone could have high blood pressure for years and you feel completely fine. Every once in a while you may get headaches from having high blood pressure, but high blood pressure itself can lead to kidney disease. And you can have pretty advanced kidney disease and never know it. So that's why it's really important to see your doctor, get blood work done, so we could catch these kind of things early.
Is anemia associated with kidney function?
So the next question is anemia associated with kidney function? And the answer to that is yes. So the kidney, all the blood in your body is filtered by kidney all day long. So, you make approximately 1.5 liters of urine a day. So that's just the blood going around in a circle over and over again. And so the kidney knows how much blood you have in your body. And also there's a cortex of the kidney makes a chemical called erythropoietin. So if your amount of hemoglobin in your body is low, the kidney generates this chemical. So it helps your body make blood. Now, so if you notice that people with kidney disease also have anemia, just because the cortex of the kidney is a little bit thinner and they don't produce this chemical as often. So yes, kidney disease does lead to anemia.
What should people with kidney failure take into consideration before getting the COVID vaccine?
So the next question is, what should patients with kidney disease take into consideration before taking the COVID vaccine? I think it's actually pretty safe to take the COVID vaccine. The COVID vaccine, as it's given, is intramuscular, so I don't think there's any side effects with kidney disease and taking the COVID vaccine. And the other thing is, people with kidney disease are generally slightly immunocompromised, so actually it's pretty important to people with kidney disease to actually go ahead and get the COVID vaccine done.
Are there any races or ethnicities that are more prone to kidney disease?
So the question is, are there any races and ethnicity more prone to kidney disease? The answer is that is yes. So any race and ethnicity that's more prone to type 2 diabetes is more prone to kidney disease. So African American races, people of from the West Indies, people from the Pacific Islanders are all more prone to kidney disease, just because type 2 diabetes is familial. So when something is familial, then you could pass it on from generation to generation. And yes, those particular groups are more prone to kidney disease because they're more prone to diabetes, more prone to high blood pressure. And those two factors are the biggest contributors to kidney disease. So again, my name is Dr. Samuel A. Agahiu. I'm a nephrologist here in Bergen County. I work for Bergen Kidney Center. So if you have any questions or have any additional comments, you can reach out to me at Bergen Kidney Center. Thank you very much.